Hello friends, in this video we will deal with gram-positive bacilli. Okay, so I have divided gram-positive bacilli like spore-bearing and non-spore-bearing bacilli. So under spore-bearing bacilli, we will discuss about two species. One is Bacillus anthrax, another one is Clostridium. So coming for Bacillus anthrax, it is a gram-positive bacilli, spore-bearing and capsulated and non-motile. So here the capsule, generally all the bacterial capsules are made up of polysaccharide except Bacillus anthrax, it is made up of a polypeptide. Okay. So next coming for the, there is a 5 specific cultural characteristics of the bacillus. So you want to remember each and every point in this. So first, it is a nutrient medium. It shows a medusa head or the frosted glass appearance. So coming from blood agar, it shows a non-hemolytic colonies. And gelatin stab culture, it shows an inverted Fitri appearance. And solid medium containing penicillin shows a sting of pearls. So here you can remember the SP. So here also S and the P. So selective medium, here it is in plugged medium. Okay. So these are the important points for the in the cultures, and you must not miss any single points. Okay. So coming for the clinical manifestations, it causes 3 types of anthrax. So one, it is in cutaneous anthrax, pulmonary anthrax, and the intestinal anthrax. Okay. So coming for cutaneous, it is the most common type. So, and it is also called as a Hyde Porter disease, whereas pulmonary, it is also called as an Wool-Sorter disease. Okay. So here the cutaneous usually manifests as an eschar and will be in malignant pustule. Friends, there is another eschar usually seen in the scrub typhus. Okay, which is caused by Orencia susugamushi. So here then pulmonary anthrax. So it causes an hemorrhagic pulmonary effusions, and here it is in 100%, it has a mortality rate. So in pulmonary anthrax, you want to remember the another term that is called as an duckering. The duckering is nothing but you will be treating a wool. Okay, so you will be treating an wool with an formaldehyde. So before getting processed, so that process is called as an duckering. So next, what are the toxins produced by Bacillus anthrax? So IPL, no? So you can remember like EPL, edema factor, protective factor, and it is a lethal factor. So here this all the toxins. So all the toxins usually act by increasing the cyclic EMP. Okay. So coming for Bacillus series, you know, like there are 2 important toxins. So one, it is an emetic toxin, another it is a diarrheal toxin. So here you want to remember the incubation period, that is an emetic toxin, it has in 1 to 6 hours. Okay. So the 1 to 6 hours just to join that becomes in 16. And here the emetic usually act by cyclic GMP, whereas diarrheal toxin act by cyclic EMP. So you can remember a patient went for the camp and he had a diarrhea. Okay. So another, that's an important clue, you know, there will be in history, usually they will be giving like the Chinese fried rice pattern. Okay, that is a specific term which have been used all time. Okay, so coming for next, it is in Clostridium. So here Clostridium, it is an all, you won't remember this. So the all Clostridium are usually motile. There's a specific term for motility that is called as a stately motile, except perfringens and the Clostridium tetani type 4, they are non-motile. Okay, so generally all are non-capsulated except perfringens and butyrium, they are capsulated. So here you want to remember all the exceptions. Okay, next. So regarding spores in Clostridium, so remember first in difficile, the spores, it will be located, will be oval and the terminal. Okay, it will be oval and it will be located terminal. But in tetani, it will be spherical and it is in terminal. So like what will be like a drumstick appearance. Okay. So perfringens, it will be like subterminal because it won't be at the end but at the edge of the end. Okay. So coming for botulinum, again it is an oval and subterminal. Okay. So friends, I will be saying, see here botulinum, it will be having an O. So you can remember it is an oval. Okay, somewhat you can remember. and here these two are subterminal, that is in B and the P, okay, botulinum and the perfringens, these both will be having a subterminal, okay. So you know tetany, you know it is a drumstick appearance, okay. So here what happens is, here there will be 2T will be there, okay. So if T is having, so it is a terminal spore, okay. So like it will be having a spherical and the terminal spore, so T for T, okay. And here Clostridium difficile is difficile, it is somewhat like difficult, okay. So just remember like idiot, okay, D-I-O-T, idiot, like that. So perfringens and botulinum, so for it has an O, just remember oval NF. So for subterminal you want to remember it is like an BP, that is in botulinum and perfringens, whereas tetany T for T, and this is caused by Clostridium perfringens, okay. So here you just remember 4 diseases. One, it is in gas gangrene, food poisoning, necrotizing enterocolitis, and enteritis necroticus. So here you remember all the diseases are caused by Clostridium perfringens type A, except this gas gangrene of the bowel or pig bell caused by type C. Okay, so this is an you won't remember because this is an again an exception. Okay. So here this toxin responsible for food poison is enterotoxin, whereas enteritis necroticans it is a beta toxin, and for gas gangrene it is an alpha toxin. Okay. So I think this tabular column will be more than enough to remember the diseases and the toxins. So next, so what are the lab manifestations or the lab diagnosis is? So first remember like C near NTR, okay. So S for stormy fermentation, N for Nicholas reaction is positive, T for target hemolysis, that is it shows in double zone hemolysis, and reverse camp test for positive test, okay. So reverse camp will be positive. So again the camp test is for Streptococcus agalactiae, reverse camp is for the Clostridium perfringens and Listeria monocytogenes. And here the RCM broth shows in sacrolytic. Okay, these are all the important points you want to remember. And just remember like C near NTR. So next coming for Clostridium tetani. So all you know there is a 2 important toxin. One is plasmin and the lysine. So lysine has no role in the pathogenicity. Okay, the only the plasmin which usually causes in causes diseases. So that is it is in GABA and the glycine. These both are the important neurotransmitters which are responsible for causing the disease, that is Rhizus sardonicus and the opisthotonus. So these Rhizus sardonicus is like a face grinning, and opisthotonus it is like a curving of the entire the body. Okay. So here perfringens, the RCM broth usually shows in sacrolytic, whereas tetany it shows in proteolytic. Okay. So another important point, it shows in swarming growth. So what happens is this spasmin usually inhibits these transmitters. These are usually it is an inhibited transmitters. So that it got inhibited, there will be an overall excitation. Because of that only there will be an opisthotonus or that is a curved body like structures. Okay, so next it is in Clostridium botulinum. You want to remember 3 diseases. One is in foodborne, infant, and the wound botulism. Okay, so foodborne, you know it is in famous, that is a home canned food. Okay, so if you're keeping some of the bottles closed overall, and preservative foods, and the infant it is usually caused by contaminated honey. Okay, and it is a wound botulism. So here what are the toxins? So botulinum you want to remember the 2 toxin. One it is a neurotoxin and the enterotoxin. Here the neurotoxin it is a potent toxin. You know there is a 1 microgram of neurotoxin is enough to kill the entire humankind. Okay, so that much it is a very virulent and it is a potent. So coming for enterotoxin, it is responsible for causing all the diseases. Okay, so the intro to food poisoning, everything. So you want to remember the 5D: diplopia, dysphasia, dysarthria, and dissenting symmetry, flaccid paralysis, and decreased deep tendon reflexes, and also constipation. So remember here, the food poisoning which is usually present with constipation, it is in botulinum. Okay, there will be no fever, vomiting, and diarrhea. So here you want to remember this 5Ds. Okay, 1, 2, 3, and 4 and 5. So you want to remember these all the 5Ds and the constipation. So coming for difficile. So what are the risk factors first? It is a prolonged hospital stay. So or if the patient is having more use of the antibiotic, especially it is in cephalosporin, ceftriaxone, and the clindamycin, ampicillin, fluoroquinolones, that too specifically it is in ciprofloxacin. And the cephalosporins, so the overall you want to remember cephalosporin and the antibiotic, they are the most common causes, and what will happen is because of this it will be causing a pseudomembranous colitis. Okay, and what about vancomycin and metronidazole? There is a special condition, or the peculiar point here is the vancomycin and metronidazole have been implicated to cause the pseudomembrane colitis, but it also has been used in the treatment. Okay, so this point you want to remember here. And so that is, these have been implicated in causing a disease, but also will be using as a treatment. So what are the toxin responsible here is toxin A, enterotoxin, and B, cytotoxin. These two are the important to causes in the pseudomembranous colitis. Okay. So friends, this completes the spore-bearing gram-positive bacillus. In next section we will be dealing with gram-positive bacilli which are non-sporers. Okay, thank you.